Now moving to the next page, we study about here about important cytokines. Okay, so cytokines, that is acute, that interleukin first 6, tumor necrosis factor alpha, and then recruit, that is interleukin 8 and interleukin 12. Now secreted by macrophage. So cytokines that are secreted by macrophage, that is interleukin 1. Interleukin 1 causes fevers, acute inflammations, activates endothelium to express adhesions molecule. Okay, induces chemokines secretions to recruit WBCs, also osteoclast activating factors. Now talking about interleukin 6, that is secreted by macrophage and causes fevers, stimulates productions of acute phase proteins. Now talking about tumor necrosis factors alpha, activates endotheliums, causes WBC recruitments, vascular leak. Similarly, for interleukin 8, major chemotactic factors for neutrophils. Likewise, for interleukin 12, induces differentiations of T cells into T helper 1 cells and activates natural killer cells. Here to remember, like a hot T bones streaks, that interleukin 1 fevers, that is hot. Interleukin 2 stimulates T cells, interleukin 3 stimulates bone marrow, interleukin 4 stimulates the IgE productions, interleukin 5 stimulates IgA productions, interleukin 6 stimulates acute phase proteins productions. Now it has been given about the tumor necrosis factor alpha, that causes cachexia in malignancy, maintains granulomas in TB. Interleukin 1 6 tumor necrosis factor alpha can mediate fevers and sepsis. So it is very important to remember. Now interleukin 8 is given about, that is clean up on acyl acylate, and the neutrophils are recruited by interleukin 8 to clear infections. Now interleukin 12, as we have discussed about, induces differentiations of T cells into T helper 1 cells and activate natural killer cells. Now facilitates granuloma formations in TB. Now interleukins produced by secreted by, that is T cells, are interleukin 2 and interleukin 3. Now talking about interleukin 2, it stimulates growth of helper, cytotoxic and regulatory T cells and NK cells. Now about interleukin 3, that is supports growths and differentiations of bone marrow, that is stem cells, functions like GM, that is CSF. Here we have discussed about different, that is interleukin 3 stimulates bone marrow, so it is easy to remember if we studied these all and memorized time to time. Now from T helper 1 cells, the interferon gamma secreted by natural killer cells and T cells in response to antigens or interleukin 12 from macrophages, stimulates macrophage to kill phagocytosed pathogens. Now inhibits differentiations of T helper 2 cells. Now induces IgG isotypes switching to B cells. About interferon gamma, increases MHC expressions and antigens presentations by all cells, activate macrophage to induce granuloma formations. Now talking about from T helper 2 cells, the different interleukins, the interleukin 4, 5, 10s and interleukin 13s are secreted. And talking about interleukin 4, induces differentiations of T cells into T helper 2 cells, promotes growth of B cells, enhances class switching to IgE and IgG, and too proud, too big for helps. So it is given to remember about the interleukin 4. Now interleukin 5 promotes growth and differentiation of B cells, enhances class switchings to IgA, stimulates growth and differentiations of eosinophils. That I have 5 BAEs given. Now interleukin 10. Interleukin, talking about interleukin 10, attenuates inflammatory response. It decreases expressions of MSC class 2 and TLPR1 cytokines, inhibits activations of macrophage and dendrite cells, also secreted by regulatory T cells. Now, TGF beta and interleukin 10 both are attenuates the immune response. Now, interleukin 13 promotes Ig productions by B cells, induces alternative macrophage activations. The interleukin 13, that is interleukin 13 promotes IgE, given like this to remember and recall easily. Now we will continue next pages in different video. For now, thank you so much.